going to talk about the final piece in your SmileSnap process, follow-up. Okay, so picture it. You've got the right mindset, you're taking advantage of multiple avenues to market your SmileSnap link. You're receiving consult requests, and you created a workflow that fits your practice. You're sending comprehensive treatment plans and even videos, but you don't get a response. What to do? Let's start with what not to do. Don't wait around for months hoping the stars align and you suddenly get a call from Sarah who inquired about veneers in March. While it does happen, you shouldn't count on it. Your patients lead busy lives and their dental health isn't always at the top of their to-do list. It's your responsibility to change that. Your follow-up protocol gives you that opportunity. Now, don't panic. Your protocol can and should change over time. Just like your workflow, it's one of those pieces that will evolve as you do more consults and discover what works and what doesn't work. You're not married to whatever you decide to do today, but you should choose a follow-up protocol today and start implementing it. My preferred method is multi-tier, meaning more than just one communication. Don't fire one message into the void and cross the patient off your list. You need to be strategic, and a part of that is varying your method of communication and increasing value with each message you send. I'm going to cover my ideal follow-up process. As always, tailor it as you see fit. This is only an outline, but it will give you a place to start, and it's just 3 easy parts. The simple thank you, the check-in, the value proposition, followed by marking the patient as not interested if you don't get a response. Let's go over each step. Number 1, the simple thank you. 48 hours after sending your treatment plan, send Sarah a short thank you message. Something like, "Hi Sarah, this is Dr. Brown. I just wanted to thank you again for trusting me with your consultation. I really appreciate you choosing me, and I hope you'll allow me the privilege of giving you the smile of your dreams. Talk soon." You always want to show gratitude for the trust these patients are putting in you, especially if they have no prior experience with your office. As you know, a lot of these patients are embarrassed. Maybe they haven't been to the dentist in years. Maybe they suffered a traumatic injury that led to tooth loss. Or maybe they just had a terrible dental experience in their youth. Whatever the case may be, they chose you for a reason, and it's important that you acknowledge that. Number 2, the check-in. 1 week after sending your treatment plan, check in with Sarah. We all know what our email inboxes look like. It's so easy for things to get lost in the shuffle. Send Sarah a small reminder along the lines of, "Hi Sarah, just wanted to check in. I sent over your consultation last week. I hope you got it. Are there any questions I can answer for you? I'd be happy to help in any way I can. You can reply to this message or call the office. Thanks again for putting in your consultation. Have a great day." It's always best practice to open the floor for questions, as it were. The options presented in your consultation may feel overwhelming to Sarah, so much so that she doesn't know where to begin. Giving her an informal method to communicate her questions and concerns can kind of lift some of that weight and open up a dialogue that leads to Sarah booking her in-office appointment. Plus, if your email did get lost, this reminds Sarah to go take a look. Number 3, the value proposition. 3 weeks after sending your treatment plan, up the ante. The key to making this communication work is value. You're sending Sarah something that is relevant and valuable to the treatment she needs. Let's talk about some examples. Maybe Sarah wants whitening, so you give her information on the difference between professional whitening and over-the-counter alternatives. Or perhaps Sarah's interested in orthodontics. You might send her some great before and after images that are similar to her case. If Sarah wants cosmetic work, there are even programs that allow you to improve the color and shape of teeth and send Sarah an image of what she could achieve after treatment. Or it could be as simple as a video of your milling machine, paired with information on same-day crowns or your in-house lab that will save her the hassle of a temporary crown and waiting for a lab to send back her case. This communication should be well thought out and as personalized as possible. Tell Sarah that you just wanted to share something about your office that relates to her needs. Increasing Sarah's education about dentistry is the surest way to gain her trust and let her know that your office is best equipped to handle her case. Now, if you haven't heard from Sarah after a month of follow-up, take the hint. You don't want to badger her. Mark her as not interested in your SmileSnap dashboard. But if feel free to reach out if and when you have additional things to offer her. So if you're running an Invisalign promotion, cash discount, and either your special, let your SmileSnap inactives know. It may be enough to push some of them over the edge, or at least keep your practice fresh in their minds. A couple notes. I suggest 2 different communication methods for each follow-up. Maybe you send a text and give Sarah a call. Maybe you call and send an email. Consumers today have very different preferences when it comes to getting in touch, and you don't want to miss out because you left a voicemail that a patient will never hear or send an email that they'll never see. Text messages, of course, are the most visible, but they're also the most intrusive. So if you decide to follow up more than 3 times, try not to overload your potential patient with texts. That's a quick way to turn them off and get marked as spam by their carrier. Respect Sarah's silence and move on. That's it. Your 3-step follow-up process. 1, the simple thank you. 2, the check-in. 3, the value proposition. Followed by marking the patient as not interested if you don't get a response. I just want to take a moment to thank you all for listening to this series. I hope you learned something. If you have questions about anything I've presented, book a free chat with me. I'd love to help you step up your game by bringing in and converting more SmileSnap consults to patients. Until then, have a great one.